Today, we're gonna begin our series of discussion of treatment and outcomes for mood disorders. So, in this series, there's gonna be a host of videos that will focus on different treatment methods, and this video focuses on pharmacotherapy. So, with regards to pharmacotherapy, our discussion is gonna begin with antidepressants. Antidepressants have many classes of medications within them. So, we're gonna begin with the monoamine oxidase inhibitors class. So this is a class of drug that acts on the neurotransmitters of the monoamine class. Monoamine oxidase's general function is to break down norepinephrine and serotonin. Both of these hormones, as you know, are generally found to be at low levels during a major depressive episode. Thus, when you give a monoamine oxidase inhibitor, such action is stopped or inhibited. So basically, when a monoamine oxidase inhibitor is given, it inhibits the work of the enzyme monoamine oxidase, which is involved in the breakdown of norepinephrine and serotonin. Thus, norepinephrine and serotonin levels are restored to optimal levels, and thus depression symptoms are reversed. However, this comes in with a host of side effects. So these side effects are linked to an amino acid called tyramine. So foods rich in this amino acid, such as red wine, beer, aged cheese, or salami, when taken along with this particular class of medication, it could be really fatal. So why is it fatal? This is because tyramine generally has catecholamine releasing attributes, which is nothing but it releases stress related hormones like norepinephrine and serotonin. I'm sorry, norepinephrine and epinephrine, which causes the body to experience extreme stress. So which means when a monoamine oxidase inhibitor is coupled with tyramine rich foods, it could lead to an increase in the levels of norepinephrine, which could lead the body to be in a flight or fight mode, which could be an extreme risk of cardiovascular attacks. So then we're going to look at the next class of medication, which is tricyclic antidepressants. So with regards to tricyclic antidepressants, this class of drugs helps to increase the transmission of neurochemicals such as norepinephrine and to a certain extent serotonin in the human brain, and is used to restore mood symptoms. However, they also have unpleasant side effects such as dry mouth, constipation, sexual dysfunction, and weight gain that kind of forces non-compliance to treatment on part of the client. Another risk of the tricyclic is that when taken in large quantities, it could be fatal. So prescription of such medications to a client who has suicidal ideations could be a risk, as they stand a chance to take in an overdose to end their lives when they have such ideations. The next class of medication that we are going to look at is the selective serotonin reuptake inhibitors, the SSRI class. This is a class of antidepressants that tend to be most often used over other classes of antidepressants. This is predominantly because of its lesser side effects, but however, they do have certain side effects, like they have issues in orgasm and lowered sexual activity interest, insomnia and physical agitation, and gastrointestinal distress. All of these are few side effects that SSRI group also has. However, this class of medications is a very commonly used medication for treating depression. Next, we're going to look at the atypical antidepressants. So basically, currently, atypical antidepressants have proven to be significantly effective and each have its own advantages. So we're going to look at a few atypical antidepressants, beginning with bupropion, Velbertin. So this basically has activating effects on neurotransmitters, typically, which are inhibited in depression, such as norepinephrine and serotonin, and is good to be prescribed to individuals who have depression with a significant weight gain or oversleeping or loss of energy, basically the atypical type. So, when an antidepressant of the SSRI class is prescribed, they may be at risk of sexual, dysfunctions that we just saw. So when such issues are considered, this particular class of antidepressant will be really helpful if sexuality has proven to be markedly declined or interests have been markedly declined, and if they really feel that they need improvement in that area and treatment as well, this class of medication will be really effective. Next, we're looking at venlafaxine, which is also called as Effexa. This is found to be very effective in treating chronic depression. So, and it's however noticed to have side effects that are similar to that of the SSRI class. Next, we're looking at the course of treatment with antidepressants. Generally, antidepressants tend to have an effect on the symptoms, okay, on the human brain, but it requires at least 3 to 5 weeks. So when a client does not show any improvement even after 6 weeks, then another drug may be prescribed, and this generally leads to compliance wherein the client tends to respond to the second drug. So with regards to prescription, we need to understand that antidepressants are generally prescribed with the same dosage for long periods to avoid recurrence of episodes. So one thing that we need to understand is antidepressants are drugs that are used to decrease the expression of symptoms. So when a patient say stops the intake of the medication thinking that he or she is fine and that they don't need to take the medication, we need to know that they are putting themselves at a risk for a relapse of symptoms. With regards to potency, the potency or the power of antidepressants as sole treatment method for depression is, however, having very much contradictory evidences, and often evidences talk about coupling it with other psychotherapy methods. Next, we're going to look at lithium and other mood stabilizing drugs. Beginning with lithium. Lithium is a widely used mood stabilizer. So it is called as a mood stabilizer because it has both anti-manic and antidepressive effects. It's more widely used in manic episodes and has been quite beneficial. Generally, individuals with a bipolar, when given antidepressants, they may be at risk of rapid cycling, and these risks may be reduced when lithium is used. Lithium is often prescribed over long periods for a patient with bipolar disorders simply because they want to prevent recurrences. With regards to research has indicated that individuals, when on lithium, tend to indeed experience fewer symptoms and episodes over the long run. So, though they seem to be effective, here there is often non-compliance on treatment due to intrusive symptoms experienced during a manic or a hypomanic episode. Lithium, like other medications, are also subject to side effects. So, side effects namely fatigue, so longer response time, weight gain, slower cognitive processing, decreased motor coordination, and sometimes permanent kidney damage. Next, we're going to look at anticonvulsants. So, anticonvulsants are generally used to treat seizure disorders. So, if you're wondering why are we using this for mood disorders, so there are quite a lot of reasons why we use them. So, let's begin discussing about it. So, with regards to anticonvulsants, there are a host of anticonvulsants, and the most commonly used one is valproate. So, the next thing that we have to understand is this is often used to treat individuals with bipolar disorders, preferably in the manic episodes. So it is generally effective in patients who do not respond really well to lithium, and it tends to lower the brain activity and is very much beneficial during manic episodes. So, however, research has evidenced of increased suicidal ideations and completed suicides when on anticonvulsants. Thus, when given in combination with lithium, such effects tend to be reduced. Next, we're going to look at antipsychotic medications. So, when patients having a mood disorder exhibit psychotic features, they may benefit from antipsychotic medications to reduce such symptoms. This can be given in combination with other medications of varied mood symptoms. So, for example, you're giving medications for depression, you're giving mood stabilizers for manic episodes. That's also fine. It can be given in combination with other such medications. So, here we come to an end of our discussion of pharmacotherapy. I hope you all enjoyed it. I hope you've all understood what I was trying to explain and put across. If you have any doubts, kindly verify. Thank you.